Hey everybody, Dr. Rob Silverman here, Amazon best-selling author of Inside Out Health, ACA Sports Council Chiropractor year 2015. I'm excited to share some updates on long hauler. Believe it or not, so many of my patients have come in and complained about post-COVID symptoms. And I can tell you that being in the office 4 days a week, and I'm lecturing mostly virtually, but in person, so many different practitioners are asking the question about long hauling. And let's get a couple of definitions of the long hauling just to help you through this. So essentially the long hauling, or what we call post-acute COVID-19, is defined as the presence of symptoms extending beyond 3 weeks from the initial start of the symptoms and chronic COVID symptoms extending beyond 12 weeks. Now, the numbers keep varying because it's not a newer concept. We actually have a definitive ICD-10 code, but what we're seeing is so many people through my tentacles go on the outside and in my office, just 4 different people, I saw 10 people up to 12 o'clock, 4 different people are having post-COVID issues. And I want to go into it. I want to give you some of the case studies. I want to offer some solutions to you. Now, there's a term, it's PACS, and it's for the long COVID, and it means post-acute sequela of SARS-CoV-2. So it's, again, they actually have a name for it. They have an ICD-10 for it. So many people also ask, well, with the vaccine and the COVID, I think that in your decision process, and whatever you decide I'm good with, in your decision process, you have to look at this long hauler within the COVID. And part of the long hauler that they haven't put in that's a little disconcerting to me is they haven't started to talk about the autoimmunity when you get COVID. So I'm going to put it all together in a nice tight bowl for you. But some of the more common symptoms you'll see as a long hauler is fatigue. That's probably number one. Everybody's complaining about being tired. The reason they're complaining about being tired, and we will go into greater detail, is COVID-19, SARS-CoV-2 is the vampire to the powerhouse of your cell, your mitochondria. You also, a lot of people have complained about shortness of breath, joint and chest pain, some organ dysfunction, believe it or not, in the heart, lungs, in the brain. It pierces the brain. It's very susceptible to getting your central nervous system, that is very susceptible to getting attacked. Your central nervous system being your spine and your brain. And one of the reasons that your brain is so susceptible, it's very simple. There's a lot of ACE2 receptors, but more so than that, it drains the mitochondria. Number one mitochondria organ in your body is your brain. What I'm seeing a lot of is post-joint pain, and something that I'd like to go into more of a detail. The complications are a definite consequence of direct tissue invasion by the virus. We're really seeing a lot of profound inflammation. There's a cytokine storm, if you will, and that cytokine storm really comes from related immune system damage. So everything's based on how pre-inflamed you were before you contracted COVID-19 and based on how your immune system reacts. So clearly, before I give you a protocol, it's evident whether you take a vaccine or not, you want to be in the best health that you can to avoid the onslaught of virus replication and what the virus can do as far as side effects. Because you don't want to be too pre-inflamed. 94 to 97% of people that were hospitalized, that died, were pre-inflamed. What you're seeing is those people who are pre-inflamed are having bad outcomes. Those who are not as pre-inflamed are having better outcomes, not only better outcomes during the course of their COVID-19 infection, but the post. And the post is what we're really seeing. Chiropractors, everybody's complaining about joint pain afterwards. Everybody's complaining about autoimmunity. Do your joint thing. Start looking at people's guts. We have the answer. If anybody out there, I'm going to say it a few times during this presentation, if anybody has any questions and they're long hauling, do 2 things. One, just put L, not for loser, L for long hauler. Let me see that you are long hauling. Number 2, feel free to reach out to me. DM me. Let me know. Let's talk about it. I'm writing some articles. I want to help you. I'm here for you. Please let me know if you know somebody who has long haul, meaning their symptoms just haven't gone away. They still have symptoms afterwards. They're tired. They're achy. They have gastrointestinal problems. They lost their hair. All sorts of things like that. They still have trouble breathing. They're not what they were as afterwards. They're a month, 2, 3, 4, 5 months after. They don't have the energy level. They can't perform like they did before. Cardiovascular is of a concern to me because it can lead to what we call myocardial injury. They did a study with Division I football players, and in the Division I, they were all asymptomatic, but 46% of them had elevated heart enzymes, which show that they had some heart issues. They had some myocardial inflammation. They had some myocarditis. So multiple studies show that the cardiac involvement is quite high. You're also going to see some pulmonary and neurological issues. The virus, as I said before, can penetrate the brain tissue via excessive amount of viruses and by direct invasion into the olfactory nerve. And that's why so many people lose their sense of smell, the olfactory nerve, cranial nerve number 1, or the olfactory bulb. As a matter of fact, studies showed that in the first month, and this was 20 people in this study, 19 of them had a loss of sense of smell. 7 were long haulers out of 20. It's 35%. So can you imagine not having any sense of smell? You think about your eating. Think about your consumption of foods. Think about just everyday living. Some of the other neurological symptoms, in addition to loss of sense of smell, or headache, vertigo. If you had tinnitus, it really brings on tinnitus. So what I've said to many patients, it's sort of like kicking the grass and a snake comes up. That's what it does to some of your injuries, some of your susceptibilities, mood swings, brain fog, things of that nature. But I really want to hone in on the idea that SARS-CoV-2 is hijacking the host mitochondria because the RNA transcripts localized to the mitochondria. That virus replication is really the issue in COVID-19. So what you're really seeing is a chronic metabolic disorder when your mitochondria, the powerhouse of your cell, is there. Higher incidence of diabetes post-COVID. Essentially, all these things make the host more vulnerable to post-COVID infections. So let's talk a little bit about post-COVID-19 syndrome and what I would recommend. Number 1, I'm a big proponent of improving the mitochondrial function because everybody's complaining about fatigue, complaining about they're tired. So 1, obviously start with good or whole foods. Eat within that 8 to 10 hours, like you've heard me talk about, that intermittent fasting, time restrictive eating, a critical component to enable yourself to have what we call autophagy, which is the breakdown of cells and the regrowth of new, more enriched cells. Think of a raisin and you break it down and you come back with a grape. Grapes bursting with water and energy. That's what your cells can look like. Some other things I would recommend, clearly organic foods, more fruits and vegetables. Try and exercise, even if it's just walking. Go for a walk. Get moving in your house. Go up the flights of stairs. We can do some things now in public that we couldn't before, that the CDC is now recommending. Let's get moving. Get a good night's sleep. Nothing's more restorative than a good night's sleep. And some supplements. I'm a big proponent of NMN, which makes NAD+. That's the new hot item. Going to do a great job for imbuing your mitochondria with energy. B vitamins. Great for energy. Coenzyme Q10. Coenzyme Q10 is the most abundant nutrient in the heart. I think 39% of the heart is made up of nutrients of coenzyme Q10. Great choice to supplement with that. L-carnitine isolates energy into the mitochondria. Alpha-lipoic acid, the only thing that I know that works with water in the fat part of the cell. Glutathione. Glutathione, interesting. There's a couple of reasons glutathione. 1, it's the master antioxidant. 2, glutathione, because I'm going to tell you one of the best things you can do post-COVID is to detox. Glutathione is a component of detoxification of the liver. That's right. Get yourself on a good detox program. Zinc, selenium, vitamin C, vitamin E, all great antioxidants. And if you really want to activate your immune system and you want to upregulate it, I'm a big proponent of mushrooms, reishi, maitake, lion's mane, changa, and shiitake. Mushrooms would be a great choice. I just want to be a little bit more precise on the type of foods. We talked about organic, low glycemic index carbs. Remember, try and eat your good quality fats, your good quality amino acids, no processed carbs, and eat carbs that are low on the glycemic index. Like we talked about before, detox. Detox is a great choice, removes all the toxins, put yourself through a detox program. Low-level laser. In low-level laser, I'm really going to segue into the idea of activating your vagus nerve lowers your risk of COVID-19, and what I found to be an excellent adjunct. So I'm a big proponent of low-level laser, which allows you to have electric magnetic transfer of energy. So a couple of things before I open up to see how everybody's doing over here. I got a couple of questions. Feel free to ask questions. I've got one question already. I'm happy to answer questions. I want to talk about a couple of my patient studies. But you know what, Julia, I know entranced by exposure to coronavirus. I think that's a great question. So essentially the way I extrapolate that is I do. I think most of the people who are long haulers had an issue before, meaning they were pre-inflamed. That's what we're seeing. I don't see that many proverbial healthy people, but there were some that were in perfect condition. But the bulk of the people, you could have probably said if they were in a room and you had worked with them, you would know which one it would be. Again, if anybody has any questions, feel free to ask questions. I'm answering questions right now. I want to talk about some of the musculoskeletal issues that I've seen. So a good buddy of mine came in and he's never really complained about elbow pain. He's now got elbow pain post-COVID. He's complaining, yes, he's tired, but he has full body aches, myalgia, if you will, posing a tremendous issue. In addition, his foot hurts. He's getting different spinal issues. Another patient today, we just looked at his x-ray and said, you know, you have, as we knew, osteoarthritis. But what's changed in the last 2 months? COVID-19. So like I said, it's kicking the grass and the snake's head's coming up, seeing a lot of post-COVID. Here's one for you. COVID-19, one of the things that they have this documented in January 11th, 2021 Gut periodical talked about the change in the gut microbiota. Everybody knows I love to talk about the microbiome. And they talked about the idea of dysbiosis, the leveling of good and bad bacteria. Most people post-COVID have dysbiosis. So in that dysbiosis, we're finding a lot of women having UTIs because whatever is going on in your gut, as far as the bacterial growth or lack of growth or unleveling of good and bad bacteria, we also see a direct correlation in the vaginal region. And about 20% of the ladies in my office are now starting to say, hey, you know, I'm going to the bathroom in the middle of the night. I did it, and some of them getting UTIs because it had changed in the bacteria. So remember, the gut is without question the epicenter of your health, but we're seeing it a lot. Also, the reason that we're seeing issues with breathing is there is a gut to lung axis. That gut to lung, the respiratory tract and the gut or the gastrointestinal tract are not actually connected, but they're not physically connected. They're communicating with each other. And what we're finding out in the lung is that the lung is taking most of the upper lung has bacteria from your oropharynx, but the lower part of the lung is not supposed to have much bacteria. When it has a lot of bacteria, it's usually coming from your gut and dysbiosis, and that's part of the reason. So again, my suggestion is post-COVID, fix the gut, adhere to my 7R program. That would be a great choice. When you add also into the idea of there's a tremendous amount of autoimmunity, a couple of studies have said between 40 and 50% autoimmunity post-COVID. Mind you that most people have or more people have autoimmunity than we thought. And viruses typically give you autoimmunity. This is the bad boy of the bunch. This is really the Jesse James, if you will. So with that all being said, obviously, once again, you want to get to the gut. Now, if one other aside, if you've in the process of taking the vaccine in a 28-day period, definitely populate your gut with a lot of probiotics. So for me, I think that this long hauler COVID-19 is going to pose some interesting dilemmas. And I do recommend to everybody, search out a chiropractor who understands the concept of functional medicine, functional nutrition, that mixes, in my vision, that takes the biochemical and takes the mechanical and molds them together. So I hope that everybody's able to use this. I hope everybody has an implementable piece. It's Monday. Look forward to seeing you in a couple of days. I'm Dr. Rob Silverman, always yours in health.